Let's begin. Good morning, everyone. My name is Cindy Danzel, and I am the Suicide Prevention Director here at National Louis University. First of all, we want to thank everyone for coming out today. So I just want to introduce who our panelists and someone who's moderating with me. So my moderator is myself and Marquise Hollifield. Say hi to everyone. And we will also have on our panel Dr. CARLA Stewart, Dr. WYTRESS Richardson, and Dr. ERICKA MINGO. So we hope that you will definitely participate with us. Use the chat box, whether you do it privately or to the whole group. Marquise and myself will try our best to ask the panel as your question comes up at the most appropriate time. If we don't get, I'm sure we might get a lot of questions, don't know, but we're gonna try our best to get it answered. So yeah, again, thank you so much, you guys, for coming to our event, the last event of Wellness Week. All right. These are our panelists, as I said. So Dr. WYTRESS, Dr. CARLA, and Dr. ERICKA. So go ahead.
Hi, everybody. Good morning. Thanks again for joining us. So our first question is, of course, why are we here? So Cindy and I and our panelists really came together this week to really think about why we're here and why we're having this conversation. We're noticing that with the rate of COVID-19 death reported by race and ethnicity, and this data is up as the earliest this week from Monday, basically is showing that African Americans and the Black community has the highest number of deaths. So we're looking at the research from Washington, D.C. based on residents per 100 residents of each group. We're noting that our Asian counterparts, our Latino counterparts, and our white counterparts are much lower compared to the African American counterparts, which we're looking at the latest numbers of mortality for African Americans. Is we're noticing that it's 2.3 times the higher rate of Asians, Latinos, 2.6 higher than the population of whites. And then just kind of looking at some more of our data, we start kind of breaking down by US states. So as you see in District of Columbia, so we have it broken down what's the population of African Americans and then the victims. So we go look at the District of Columbia, there are 46.4% of African Americans in the population of the state, but 81% of African Americans are dying of COVID-19 or victims of COVID-19. Same thing with Mississippi, we're looking at 37.8% of population, 63.9%. Georgia, 32.4%, 55.9% is victims of COVID-19. Louisiana, 32.7% of the population, 51.8% of them of African Americans are dying in Louisiana. Alabama is, the population is 26.8 and 46.8% of African Americans are dying. If we look at Maryland, we look at other numbers, 3.9%, 44.6% are dying. In Illinois, this is really interesting for us to look at. We only make up 14.6% within the population, but 41.4% of African Americans are dying. And then you notice is that we look at this throughout South Carolina. Our numbers are 27% in the population, but 39% are dying. 22% in North Carolina, 37% are dying. This is also, look at Wisconsin. It's 6.7% of African Americans, but 36% of those African Americans are dying. Michigan, we're 14.3%, 33% of us are dying. Missouri is 11%. 31.2% of African Americans are dying. Florida, 16%. And it continues to go on and on and on. I see our numbers are almost triple to what our population is, to why African Americans not being here and dying. So the next piece we wanted to kind of go through.
Right. So as you can see, based on what Marquise was saying, right? So we looked at Illinois, right? So we said as of April 30th, right, about 2,400 Illinoisans have died from COVID-19. 40% of whom were white, 35% were Black, and 14% were Latino, right? And by way of comparison, white accounts for 60% of the state population, Latinos make 17%, and then African American only accounts for 14% of the population. So you can see where there's that disparity in the amount. 35% of Illinois Black population, right, have died, whereas we only account for 14%. So we know there are some real issues going on. So that's why we decided the best thing to do is to create this panel, right, and talk to our panelists about it and see what their thoughts are, what our thoughts are, what our community thoughts are. So I figured this would be a great panel for it. So I guess we will start with our questions, right? This is where it goes. So for our panel, right, our first question would be, why do we think that number is high? ERICKA, CARLA, WYTRESS, whichever one wants to grab it. Why do you guys think the number?
So I think you know, it is historical. I think it's historical injustice, and I think that we have flawed healthcare systems. And I think that, you know, based on the historical context of where we are, that would be a reason why Black folk are, you know, higher in that number of the number of deaths.
Yeah,
No, go ahead, ERICKA.
I was just gonna say I agree 100%. It's historical patterns of pathology and aggression against these communities, and there's really no kind or pretty way to say the problem, particularly in this moment when we're talking about people's lives. And it's some unpleasant realities that need to be faced. And quite honestly, Black people and Latino people, but specifically Black people in these health contexts, are at the bottom of almost every negative health statistic. Or I should say at the top, like our numbers are higher disproportionately for every negative health statistic. So I don't know why we would expect COVID-19 to be different. This is what happens when a people live under consistent oppression and repression, consistent patterns of pathology and aggression. There's just no kind way to say it. And in this moment where the lives are being lost and highlighted, it's an opportunity for us to take the unpleasant look at the very ugly thing that is causing this and other disparities for these groups of people. So it's a moment of bravery, really, to be honest with ourselves and everyone else about what's happening here and what has been happening consistently for decades.
An opportunity for change. I'm sorry, Carla. I just had to throw that in there right off of ERICKA. An opportunity for us to change. Go ahead, Carla.
And when you think about it, what WYTRESS and ERICKA are highlighting is the fact that there's a lack of access to resources in our communities a lot of time that will give us the resources to and access to things that will boost our immune system, that would help us to live healthier lifestyles, whether it's physical health, emotional health, or mental health. And so because of that lack of access to resources, it just makes sense that we will be hit harder because we don't have shields, we don't have barriers that will keep us from contracting viruses and keep us from, getting support for our mental health and getting support for our physical health. So that systemic thing, that historical systemic oppression that we've experienced has contributed to us being, more highly affected by anything that comes through, whether it's financial inequities, whether it's, medical inequities. It's historical.
And I think it's layers to it. We're talking about the COVID-19 and the health disparities, but we have a lot of disparities that would lead us to this situation. So, it's layered. It's not a one-off answer, to the question.
Perfect, which is great. Thank you all. Thank you, ladies, for your response and for this question. My next question, when Carla really started talking about resources.
Marky, there's someone named Tom who put in like a question or like a comment, and I want him to say it because it's kind of long. So I want to give him the opportunity. If you're okay, Tom, saying I will unmute you and allow you to say what you said. So go ahead.
Oh, thank you so kindly for that opportunity. Good morning to everybody, and hope everybody's well and safe.
Hi, Tom.
Hello, ERICKA. Hello, Dr. WYTRESS. Hello, everybody. Yes, I'm on faculty at National Louis. I'm a newbie from last year teaching public policy. Anyhow, I work with a group called the Civic Lab, and we've been looking at TIFs, tax increment financing, for 7 years. And we've been lucky enough to be invited to 160 public meetings across the city to talk to the neighbors about this and other matters. And one of the things that's come out of this research and our work with activists around the country is that TIFs are racist. And part of the things that you are just speaking about, this history of oppression. And we are calling for the abolition of TIFs right now and the liberation of the $1.2 billion sitting in the TIF accounts. That's our money, our property tax money, immediately into African-American communities that have been so hard hit, as you have just stated. The facts speak for themselves. So the money is there. It needs to be put to use into the street right now. And not doing so is a matter of great ethical fallacy, from a mayor who calls for racial justice. So we're asking anybody who knows the mayor to, help her liberate this TIF money. And that's really our message.
Thank you.
Thank you. Thank you.
Thank you. So going a little bit back to what Carla was talking about, resources, our next question for the panelists is, do you think because of the lack of knowledge, is our community taking it seriously, or do they really know that they're dying at, that we're dying at a higher rate? And so when we talk about that, because we've seen things over the coming weeks, over people attending weddings and funerals and having parties and going outside, sitting on the beach, doing all kind of things that we've been told not to do. But we have seen there has been a little bit of that going on. So do you think our community understands, do they have the knowledge and the well-being to even know that they're dying at a higher rate?
So I think that's a layered question too. I think that, there is, we're talking about different generations in this knowledge. If you ask me, and we're talking about different generations in knowledge, but we're also talking about a media issue that will display Black folk as being the ones who are not who are not really taking heed to the messages of sheltering in place. But we don't see that, coming from other places too. So when I talk to, my North Side counterparts, they got cabin fever too, and they're out and about, but we don't see that, played over and over or cycled in the media. So to answer the question, yes, I do think that, we as a people understand the seriousness of it. If you are communicating with someone from an older generation, they're worried and concerned. They're watching the news. They're sheltering in place. They are worried about how they're going to eat and how they're going to get to the doctor and how they're going to do all of these things. But if you're talking to a millennial who don't have the same worry about it or think that we're being too, over the top. I have 2 millennials that are my children, and they are like, Mom, you're just over the top. You're doing too much. And so I think that there is a difference in the knowledge base. And so, yes, I do think that we are concerned, but it would depend on who you're talking to.
And I hate that sometimes, to back up what WYTRESS is saying, I hate that sometimes we take the part and attribute it to the whole. And so we see these isolated events and these isolated situations, and we feel like that's representative of our entire community. Why is that representative of our entire community? Have you polled our entire community? Have you gone in our neighborhoods to see who's in and who's out? And so you take a couple of isolated incidents and say, African Americans are not taking this seriously. The young people are out in droves, but you're not looking at the fact that the majority of us are sheltering in place. We are concerned because we recognize that we have increased health conditions and we have things that make us at a greater risk or more susceptible to this virus. So I think taking those little small sound bites or captions or isolated events is not fair to us as a community. And so in the media, it's being, touted as we're being irresponsible and we're not taking this seriously. But I think that just really does all of us a disservice as an African American community, because that's not completely true.
And those sound, and, oh, I'm sorry, Erica. Go ahead.
Yeah, I was just going to say, I agree completely about it not being a representation of everyone. And I definitely wanted to piggyback on what WYTRESS was saying about just the gross disparities in the way that the news was reporting what was happening, particularly when I saw with my own eyes, just in the West Loop and in other places, the city was blanketed with people. And when I was actually out in just getting groceries, I mean, what I saw on the warmest days in the past week was an overwhelmingly non-Black population out and just, again, sunbathing, just blanketing. And further, not only did I see an inequity in terms of who was out versus who was in, and I saw overwhelmingly more non-Black people out, the ways that they were treated was very different. The way that our mayor chose to address the Black people that were out, and the ways that she chose to challenge and even threaten the Black people that were out, as opposed to some of the images that we were seeing where other populations were getting face masks and being asked to kindly, go this way or that way. So it's a real sticking point, particularly when we talk about, do Black people understand the danger of what's happening? I think that we do. But I think that we have a lot of skepticism, particularly because, again, we have to look historically at the ways in which information has been rolled out to Black communities, the ways in which Black communities have been engaged surrounding health measures. We still have not, in many instances, forgotten Tuskegee. And the millennials and other young people, they grew up under Google. So they know how to get access in a heartbeat. And so when the government says A, they have come to understand that B, C, D, and E is available for them online. And so they're not just getting their information from the typical sources, they are looking to educate themselves in a million different ways. And that information oftentimes contradicts specifically what's coming from the White House. So when you have a government and when you have information coming to you that you are rightfully skeptical of because of the ways in which your population has been treated in the past, again, historically, surrounding your own health, surrounding your, again, being at the bottom of every statistic, I don't necessarily agree with their decisions, but I certainly am not confused by their decisions because, again, they have been misled, they have been misinformed, we have had the privilege of growing up in a far more reasonable gubernatorial world in terms of politics and government. What they have come to grow up under, what has become the norm for them, is a feeling of mistrust, which I can't say is 100% misguided. And although I wish that they would take more precautions, I don't want the feeling to be that Black people aren't taking this seriously or that Black people feel like they don't understand that they're dying at a higher rate. I think they know that better than we do. Their friends are the ones that are dying consistently every single weekend. I think they do take it seriously, but at the same time, they feel like they have to kind of figure things out for themselves and forge a path based on the information that they've gathered and not just the information that has been handed down to them from on high, particularly when they see themselves being disparaged in the media at every turn, including who's in and who's out.
Thank you, Erica. Actually,
and so to add, just to drop a little bit more onto that is the question, I mean, it's a great question, but then is the question, asking, do we know or do we understand? Yeah, we understand. We're not, out of touch. We do completely understand it all, but it goes back to how we're portrayed. And I think we have to keep that in the forefront.
Cool. Thank you. We had a question from Adrian who talked about how much do you think the historical informed fears and distrust of our medical/government systems impact people's willingness to shelter in place or to participate in protests of the shutdown? So Erica spoke to some of this a little bit, but I wanted to get the question out there because it is a really good question. Thank you, Adrian. So comments?
How can we protest when we're sheltering in place? We can't, we can't do that right now. And that's part of the problem. because now, you know, if we didn't have a shelter in place, then we would be out there marching about the seriousness of this and Black people dying at higher rates than anyone else. But we can't do that.
And think about what a protest would look like for us versus what a protest would look like for other people during this time. And so, I mean, really think about it. If we're out there and we're on the front lines and we're doing, you know, I know we're going to talk about essential workers, but if we get out there with our, you know, we have our masks or we don't have our masks, would we be treated the same as another ethnicity that would be out there protesting the same thing? Would we get equal treatment? Would we be seen as a mob, or would we be seen as, you know, very fine people that are protesting an injustice? So we have to think about it in terms of safety, because sometimes for us, the reason why we don't move and get into action is it's a safety issue for us, because we don't want to die necessarily on the front lines. We want to be able to champion our cause and see results from what we're doing. But if we are going to be treated as if we are criminals, or if we're going to be treated as if we are, you know, don't belong there, or we're coming to do something nefarious, then of course we're not going to, you know, organize around that just yet. I know a lot of people may be doing some things behind the scenes, but you'll see it. You've seen it on the news in different states. People are storming capitals with guns, and they are being treated as if that's okay. I mean, they're storming government with guns. But if that was us, then how would we really be treated?
Right.
And from a historical context, you know, there has been, I mean, we were hosed down for protesting. So, you know, there is a difference. And I see that in the chat, Maggie mentioned that we could, I'm sorry?
No, go ahead, go ahead.
Yeah, I saw something about, it went quickly because chats are coming, but Maggie mentioned something about banging pots. Yeah, we're banging pots in my community, but who's here reporting the banging of the pots?
It doesn't,
You know,
it doesn't give you the next story.
There's you know, and I organized that in my community, that yes, we need to get together, yes. And you know, when media, again, this whole media thing is a problem in the Black community, because we are not portrayed in the Black community. You know, when the media comes, there's never, or I shouldn't say never, let me change that. Most of the times there's nothing good of it. And so there is the problem. In my neighborhood, we're just coming out saying, hey, we support essential workers, all essential workers, not just nurses and doctors. There are essential workers that are going out on the front line, and they're not getting paid or taken care of the same way as the nurses and the doctors are taken care of. So there is a vast difference in, you know, the banging of the pots and the doing all of that stuff. It's not going to be reported as that, you know, so it does pull people back from doing certain things in the community, because it just wouldn't be seen the same way.
For us, banging the pots would be making noise and disturbing the peace. That's what banging pots would look like in our community.
That's the first thing I thought of when they wrote it. I'm like, yeah, that sounds like, yeah, someone's reporting us.
Yeah,
Erica.
I mean, that's where I think alternative sources of media become important, because the nightly news and corporate controlled media oftentimes don't tell the whole story and have no intelligent interest in telling the whole story. It's actually counterproductive for them, and their ultimate goal is to tell the whole story. But there are Facebook pages, there are social media, and particularly when we think about millennials and younger, they have their cameras out and they're unafraid to tell the whole story. And so I think that our story is being told. It's just a matter of us shifting the values, our own personal values, in terms of where we find our media. So, I mean, I shows like Democracy Now! Shows, I mean, Al Jazeera Media, I mean, there's so many different sources, and even, again, just people's Facebook pages can be a wonderful source. I mean, I saw a young man shot on Facebook Live. I mean, and the media would have never covered that. If there was not a cell phone out when the young man was killed in Georgia, nobody would have known. And so our own independent sources of media, I personally value that infinitely more than the nightly news or even the broad CNN and national news outlets, because they are not going to give an adequate depiction of my population. So I trust the news media sources that have been trustworthy. And I think that's where we can start to see the truth and who we are and count on them to tell our story. But I didn't want to miss out on the opportunity to talk about the distrust that the Black community had, because I think that was part of the question too.
Yes.
About historically the distrust that has been fostered in our community. We have been experimented on. I mean, even recently, they said, let's go and test the vaccine in Africa. Let's go and see how it works there before we give it to real people. I mean, honestly,
Ooh, control it, honey.
what intelligent Black person would not have a healthy mistrust of the medical establishment? I cannot tell you how many times I have seen story after story. A large number of my own personal family has worked in hospitals where there have been grotesque disparities in how Black people have been treated and how white people have been treated. There have been nurses who have taken, again, to alternative news media outlets, i.e. their social media pages, to say, yeah, when there's one ventilator and there's a Black person and a white person, guess who's getting that ventilator? And then issues of class confounds and other things. So of course, there is a mistrust of the medical establishment, and to assume that that mistrust is unfounded, or to look upon for your gaze to be on Black people, like, well, why? Why don't they trust? I mean, come on, you don't believe that, do you? I mean, I can't tell you how many times I will, explore an accusation, and the response that I get is, you don't believe that, do you? Because someone else's frame is very different than my frame. Absolutely, I believe it's plausible. I will be looking into it, and no, I don't have the same trust that you have, because I haven't enjoyed the pathological mistreatment of Black people in favor of better treatment of white people. And I'll be clear to call that pathology. It is not a privilege. It is pathological to do that inside of a civilized humanity. It is pathology. It is by no means a privilege. Privilege is a cookie if you ate your whole dinner. Pathology is what's going on in the hospitals.
All right. Oh, you did it too, Carla. I'm like, all right. Preach. All right.
I love
Okay.
it.
Right.
I love it.
Right. Okay. So let's go with Dan, because we're talking about essential workers. So I think it's very important, right? What the media is showing, what we know is really like the essential worker. So what does it mean to be an essential worker, right? What does it mean?
I think it depends on who you ask.
Yeah. Go ahead, Carla.
Come on, Carla.
It really depends on who you ask. And we've decided, or someone decided, I can't say we've decided, what essential means. We've decided that the essential worker is the person that we can't, their services we can't live without. And typically those services are paid at a lower rate than the people that are receiving the services. And so when you think about essential workers, it's our garbage men, it's our, grocery store workers, it's even the fast food workers, bus drivers, all of the people that typically are going to have a greater contact with people, right? So you say we're essential, but we're going to be the ones that are at the greatest risk. So it's more than just being a worker that, is needed. You're putting your life at risk while receiving a low salary or low pay. That doesn't seem fair, right? I feel like if I'm essential, then that means I'm valuable. That means I'm important. That means I have worth. So we need to look at that too, because we're talking about all of these essential workers, and they're putting their lives on the line every single day, just so we can still have a bit of the comforts that we are used to having while we're all sheltering in place. And so, like WYTRESS said, it's not just the nurses, it's not just the doctors. I'm a counselor. I'm still seeing clients. It's the counselors too. And we're all dealing with, a bit of mental health, some mental health issues during this time. So we need to really examine not only what we view as essential, but how we take care of those essential workers in terms of salary, not just taking a lunch to them, which is great, not just giving them, a couple of little gifts, sending them a gift card, but structurally, how can we make sure that these people are taken care of?
And recently in the news, so we're talking about, healthcare workers, right? But there are a lot of healthcare workers, not just doctors and nurses, but those working in senior citizen buildings that were just about to strike this week until they came to a conclusion that, okay, we're going to do something. We have to do better at taking care of people that's taking care of us. And Carla said something that I thought it spun in my head about, the essential workers are those who are giving us some of the comfort they're giving us essentials that we need to live. These are not just comfort things. We gotta eat. We have to, you know, some people have to go into the doctor. We have to be about the business of living. And the essential workers are on the front lines every day outside of their shelter, you know, making sure that we're able to continue on as human beings. And we need to acknowledge all of them. I have a cousin that works for Comcast, and he hasn't had a day off in I don't know how long, because he's considered essential, but you know, people want their cable. So he's going into people's homes, and he has not been going into people's homes with the proper gear. You know, he doesn't have a mask that his company supplied for him. He has to wrap himself up with headscarves so that he's not breathing in other people's, you know, air as he goes to work. Now, to me, is cable essential? Not necessarily, but they have made this an essential job, and we're not providing these what are the masks?
N95?
Yeah, those masks for people that work at the grocery stores that are coming in contact with people that work for, you know, any infrastructure that we have. We need to be doing the same thing across the board. Again, we are talking about things that are not equal, and we're highlighting the people on the front line. And I love, you know, healthcare workers, let me tell you. But I also know that there are other people. Banks are still open. You know, my sister is a bank executive. I'm like, do all of your people have masks? And early on, it was a no. And I'm like, well, wait a minute. What are you saying? Advocate for that. Make sure that the people have what they need as they're dealing with other people, because technically we don't know who has the coronavirus. So we need to protect those essential workers that are going out every day. You know, I think that there are some disparities. We need to take a look at these things that are easy fixes. If you're out there every day to make sure that we can live, then you're essential. You're leaving your incubated space that you know is safe. You're essential. You have to do that, because if people had choices, they probably wouldn't.
True.
I just wanted to. That's all I want to say. If people had choices, structural.
True.
And I just wanted to take a moment to share. I mean, everything Dr. WYTRESS said, 1000%. I mean, there's such a variety of folks that are out there and that are essential for people that we miss that we can't continue. You know, civilized society can't go on without water treatment people and those delivering food so everybody that we named and then some. But I think that we would be remiss if we didn't take this moment to really understand the ways that essential is seen outside of a pandemic. So when we go back to quote unquote normal, who will be essential then? What will the pay structures look like? When the crisis is complete or when we're told that it is, how will we treat these people then? And why is it that we allowed them to be treated in such a way previously? The same folks that were adamant not to give these essential workers, the Grubhub delivery people, all these folks, they were adamant that they didn't even deserve $15 an hour, are suddenly the very life force that's keeping these folks with their groceries and so forth as they sit on high, waiting for their Amazon delivery. And so the very people, so it's just, for me, it's an opportunity to reimagine the world that we want to live in when this is over. Because these discrepancies are being highlighted and they're undeniable at this juncture. I mean, there's issue after issue. I won't get into every single one, but universal health care, there's issue after issue that went ignored prior to the pandemic, such as who's essential and who isn't, and what work is valued and what isn't, that we have a moment to capitalize and say, these people are not just essential today, they'll be essential tomorrow and 20 years from now. So let's imagine a society where they're treated as such consistently and not just when they're needed, because that seems unfair, unethical, and inhuman.
And that would take, you know, it would take policy change, and over and over and over again during a crisis, we have seen policy changes not happen. You know, we can go back to Katrina. Policy change did not happen well enough for us. So it's a lot of things that we need to do at a policy level that needs to change. And essential workers that should be something that we need to advocate for, you know, after the fact. It's all good now, but after this is all over with, what comes out of that is going to either make us or break us.
True. Because then the things that we need right now, once it kind of dies down and everything, then we forget the people who actually helped us through all of this. And then we just move on because they're no longer here. They're in our rear view mirror now. So we're over it. So just go ahead.
So yeah, I was going to say, as we start to really think about some of these different pieces, I know I'm coming up on our next question. And so we really started to think about, we talked about this a little bit, does healthcare disparity contribute to this issue? And we're going to say a resounding yes. But some other places I want us to think about, kind of coupled with this, thinking about, as we talked about before, policy changes and so forth, thinking about like those who didn't have health insurance, those who had to go to work when they were sick prior to this. Do we think and believe that some changes will come about for all Americans, not just African Americans and the Black community, about this, with companies understanding the now it could be a death sentence for you or someone else at your company?
I mean, I think we've seen this issue. It's a presidential election year. This is not a secret. We've seen this issue come up again and again. Should this be left to individual corporations, or should this be a universal right? And I don't know where people land that, and I won't politicize this conversation in that way, but I think that certainly that's where the opportunities lie with regards to thinking about sweeping changes. There's levels from the federal government to corporations to individual communities and workplaces, and we have to determine, do we want to pick and choose, or do we want everyone to be covered and cared for? And I think that that's the kind of conversation that has been thrust to the fore as a result of a global pandemic. It's undeniable, and it's time to really consider, again, what we want the world to look like when this is over.
Well, another thing to think about is this is highlighting the lack of human compassion in a lot of areas that has been historic. And, you know, the idea of pulling ourselves up by our bootstraps when we don't even have boots sometimes. And so I think that it's going to take something like this to get us to a place where we start caring for others, but I don't know if this will be the thing that shifts that for everyone. It may shift it for some. You'll see some changes happening. You know, we thought that people couldn't really work at home and be productive, and now everybody's working at home. You know, we didn't think that people could, you know, handle certain things, but now we are. So some people, for a lot of people, this will change how we operate. We've been running at a breakneck pace. We've been, you know, maximizing profits over people for a long time. So now some companies are going to make the shift. Some people will make the shift in mindset, but I believe that there will always be some that will still come out of this feeling the same way that they felt before. And so we have to look at how we will respond to this. What is it that we will do in order to act change? What policies will, you know, how involved will we be in, you know, making sure that the poor are taken care of, making sure that these disparities are addressed. So it's highlighting something that's been around for a long time, and a lot of people have been working towards it. So it just depends on what we're going to, you know, get together and start to focus on, that we'll be able to affect change in our own communities.
And I do think it's opportunity here. So, you know, we're never without hope. And I think that this situation and the unveiling of these disparities are essential, right? It is, ERICKA said that it is an election year. Here is where we now have voice. Here's where we start to work with the people that have that make the changes. We start to demand more things. So I think, you know, when we talk about Black people, I think You know, we're always with hope, but there is just a time where we just get frustrated. And I think now is where we really just hit the ground running and not allowing these things to fall by the wayside, but holding people accountable, because we have a lot of politicians that are not being held accountable. And we've seen that over and over and over again. And we just say, oh, forget it. And then when it's time to vote, we don't do that. And we don't have a voice there. So it's a lot of, I mean, it's not just a one-off. It's a lot of things that we could do as a university, a higher ed university. There are a lot of things that we can do right now to start to get out there to say, hey, we're not standing for this, and to engage other people. So one thing about this situation, it can't be just one person. We have to have the voices out there saying, we want change. We can affect change, we just need to do it. The students, they have voice. How, you know, one assignment that I give in my class is, who are your politicians and how do they know you? How are they connected to you? Right, Margie? And so, do they know that you're a student at National Louis University? They have that assignment to do, holding them accountable. Go to them and say, hey, I'm a student at National Louis University. I want to know how I can affect change right now with you. How can we work side by side? If we don't hold them accountable, they're not going to do anything. And we'll just have more of, you know, of the same. We don't, you know, it's time out for that. And I think that this all is happening for a reason, for such a time as this. It's time for change, and we are the change.
I agree. I think you've allowed us to go to a couple down questions about like what role, so I asked other panelists and anyone who else who wants to respond, what role really does higher ed, right? Do we as educators, staff, faculty, administration, students, right? Even parents of students, what role do we at higher ed, how can we play that as we recover? How do we help our community recover from this?
I'd like to just take, oh,
go. Wait.
I was going to shameless plug. I'd
Okay.
like to take an opportunity to share that I'm the faculty advisor for the Black Student Union, which was started by Sonia Hilson in the community psychology program a few years back. And she was, you know, it's an organization that's new-ish. And it's just been this year that I've started to try to work with Marquise to give it some legs and teeth. But I mean, I honestly have to say I'm super fired up in this moment to utilize the Black Student Union towards these kinds of social justice ends. And I would just encourage anyone that's on the call that's interested in playing a role in the Black Student Union to email me. I'll leave my email in the chat. But that's one vehicle that might be useful for us to begin to organize and think and plan, utilizing the resources that the university has given us to really build and grow in numbers and impact some true changes from a social justice lens. And so, you know, in the past, it hasn't had as much might as it could. And I think we've found the moment for the Black Student Union to really grow and expand and start to exercise some of the influences that it could have across the city, and certainly in partnership with other colleges and institutions. So for those reasons, I'll leave my email in the chat, but I think that could be one major way that particularly in the Black community, this institution could exercise some influence through the Black Student Union, founded by a Black student at this university not too long ago. So I'm very proud to be the faculty advisor for that. And I'm going to share my email for anybody who would like to join. Yeah.
I think another way, thanks, Erica, that's great. I think another way is getting involved in your community. You know, as we students, you know, are getting educated, our education is not just for us. Our education is to go out into our communities and do the work that's needed. Not every person in our community can do that. You know, some people don't know how to do that. We're here getting an education in higher ed so that we can go back and change our communities. We have a responsibility to help pull people forward. You know, I grew up that way. It was like, you know, you don't, This is not your education. This is our education. So, when grandma and granddad and all of the, people come to salute you at commencement, they're coming because they have a stake in what you're going to do afterward. And it is in the community. And the community means partnering with those non-for-profit organizations that are doing the work, because there are a ton of them that are doing the work. Sometimes we have to go and help them, pull them along, give them, we're learning things so that we can go back and help people. So we have that right, in the community. So now we have the student union that can get into the community. Every student comes from a different community. If we had the students in those communities, teaching people what to do, teaching people how to make change, it's those small things that's going to help us to move forward.
That's so true. So I wanted to unmute Denise because she's been lit in the chat, and I want to give her that space to like say whatever she wanted. So Denise,
come on, Denise.
First of all, I just want to say I've enjoyed this. Y'all been preaching. This is resonated with me because I'm personally affected. I have already this week have had 3 family members pass from the pandemic. Just literally the other day was a recent family member, and it's literally like they're dropping like flies. Like, oh, so-and-so is being rushed to the hospital. Hours later, they're dead. Like, and I don't know, I can't speak for anybody else, but these inequities were happening long before the pandemic. And I think that's what's bothering me the most. I see so many organizations providing real relief right now for people, but it's temporary because these people were in need before the pandemic, and they're still going to be in need after the pandemic. And so what clinches me the most is, what can we do as a Black community? I mean, I'm not even going to pretend like we haven't been doing anything, because clearly history shows that we've been fighting since 1619 for just to exist in America in peace. And so what does it look like for us to continue this tiring, life-threatening fight without being overwhelmed? Because I know it's overwhelming as an individual, but collectively as a whole it's overwhelming. So what can we do? How are we going to uplift each other when we protest, when we see that our protests are ended in violence, when we have no guns, we are not fighting physically, we are not saying obscene things, but then our counterparts, our white counterparts, can literally do the total antithesis of what we're doing, fighting for something that isn't even, I'm not going to try to speak on what other people feel like is valid or not valid as far as what they believe is a right or not, but for them to be fighting for something that is affecting everybody. You want to be let out the house, everybody in the house. Black people fighting for what you want. And so I don't know, like, it's discouraging to see that. And so how do we tell Black people, go out and fight? Well, this is what we're seeing. Like you say, millennials are seeing these things. And I'm sorry I'm being long-winded, but
no.
Professor Mingo said, I'm fired up. I've been fired up. And the people who know me, Denise, stay fired up. So,
So Denise, let me say this. I know that, I'm 50 something years old, and I know that Black folk get a bad rap about, not caring for people and not doing that. We care for each other. And during this time, one thing that we can do is continue to love on one another, which is what we're doing. We're making sure that people are eating, even if we have to share a pot of beans. You understand what I'm saying? And we're calling grandma to make sure that grandma is taken care of. We're doing all of these things. We have to keep doing those things. And those things are not highlighted, but this is what we do. We do this. And we have to know that in the end, we're going to be okay. We are not, it's not an easy work. During Jim Crow, the state of Georgia was shut down because Black folks decided that they weren't going to take the bus. They weren't going to use public transportation. We have to do more of that. We have to come together and stand together and work together to say, hey, we're not standing for it any longer. So that work takes time. It takes, you know, us coming together. It takes us doing the work. And it is a tiring work, but that is what we have to continue to do until our voices are heard and until there is change, you know, at a policy level. We don't want small change. We want big change. And until it's change at the policy level, it's not change.
That is true. That is true. So I'm trying to find her. Janet had said something in the chat, and I wanted to hear her take on what she was saying. I'm missing Janet.
I'm here.
She's right there.
Okay, you're there. Sorry, I'm like looking through the names, so I apologize. She had said something, and I wanted to give her a voice. Go, Janet.
And I don't want to take away from the space. I'm a white person, and I'm looking at this in terms of what those of us who have the privilege of being white can do to continue to do this work, and how we can advocate. I think about things like when you mention who we're following on social media, when we're mentioning how we disrupt racism in those we see, but I'm not experiencing the same thing. And so I just brought that up in the chat in terms of what can we do, what can we all do to support people of color in this time and in any time. And I also want to say that a good part of the audience is from our class, which is the Urban Teacher Residency AUSL class. We normally would meet face-to-face today at this time, and we came here to hear you. And Denise is one of in the class. Anyway, that was my comment, and I would really love to hear more or not. I mean, I just don't want to take up the space and make the conversation about that.
No, but it's okay. This is what it's for, a conversation for everyone, right? Because it takes a community to change, to make policy changes, not just one, right? Because that's what happens a lot of times is our silos, like, oh, it's a community. So thank you so much, Janet. So I know we have like 8 minutes, right? I know we can just like keep going, but I want to give you guys the space to talk about what Janet said. How can people help? What can we do?
It's so great that teachers are here or soon to be teachers are here, because that is the seminal space to raise a generation of critical thinkers who will find those that are Black will find their mistreatment unacceptable, and for those that are teaching them to find ways to unravel the lies that they've been told about themselves and their communities and about their very own potential, so that we might have a generation that's ripe for the sweeping changes that are necessary, not just on a racial level, but on an environmental level and almost every other metric. I was thinking about James Baldwin. I don't remember who was speaking, but I looked up his quote because he said, to be a Negro in this country and to be relatively conscious is to be in a rage almost all of the time. Mm-hmm. And James Baldwin is my absolute favorite author. I teach his work every term. And we have to raise the consciousness of Black students to address Black issues, because they indeed are the only ones that will, and the only ones that can and even should. They can have allies, and white people can accompany them in that process, but they will be the fore and the leadership in these movements. And it's up to the community to take responsibility for our work and for others. And this is maybe controversial, but oftentimes what's most needed is for others to get out of the way. Because in many instances, we're headed in the right direction. We're doing what we know is best intuitively, and we are rerouted by nonprofits and other organizations that have an agenda for us that is completely separate from the agenda that we have for ourselves. And that has been problematic on a myriad of fronts. So to your point, you bringing your class here today is a magnificent first step. The ways in which you teach the teachers to raise a revolution, really, because that's what's necessary, and not revolution in its traditional context, but in a complete shift in the way that we do things. A 180 turn, that's what a revolution is. It is a turn in the way that we do things, because what's happening now with our planet, with our people, is unacceptable. And the next generation is going to play a hearty role. And so thank you for bringing your class. Thank you for exposing your students to this dialogue. And thank you for being, willing to address this issue head on. And I think that that level of accompaniment is a fantastic first step, and everything else.
And I totally agree with that, ERICKA. And I just want to add that, COVID-19 has showed the disparities in healthcare, but it also has exposed the disparity in housing, the disparity in education, the disparity in just having access to healthy food. So everything is coming out of this. And if we can, do everything that Dr. Mingo said, educate our students at every level to know that people know what's best for them. And so you need to work alongside of the people that, we're trying to save. Black people know what's good for Black people. We can't be saved. We can, and I hear that a lot, like, we just want to go out and do something. We want to save. It's no saving us. Help to work by working alongside and seeing that as valuable. I think that we have to see the value in what's happening. I think that's the key. How can Janet asked, how can you help? You are helping right now by exposing, and your students are hearing what they can do, because a lot of these students are going to go into communities of people that don't look like them. And how do we help the students to recognize their value? How do we help the students to know that they really matter and that they can do things well above what other people limit them?
And we understand that it's a vulnerable place to be, to not be in the forefront of a movement. It's a vulnerable place to be, to kind of step back and say, okay, I'm not taking charge of this, even though I want to be, I want to help and I want to be, in an ally. It's a vulnerable space to say, I might not know what's best for this movement, but I'm going to support what you tell me is best. Whatever way that I can be here for you, whatever way I can assist, that's what I'm going to do. And that's what's needed. That's exactly what's needed. Just listen, and you all being here in this space, it speaks volumes that you are listening, you are invested, and that's what's needed.
So ladies, first I want to say thank you so much. We have really enjoyed this conversation. It's amazing. We may be doing a little bit more of this as it comes out. But WYTRESS, I want to say thank you. You was reading my brain, because all in my head was, we don't need saviors. We don't need people to say we need to save the poor Black and brown children. We need to save the Black community. No, we know what we're doing. We need people along the side to help and support us along the way, but allow us to lead and guide and tell you what we need, and then listen, do what it is that we ask of you, and not for you to do your own thing, thinking you know what's best. So I just want to say thank you. You were reading my brain. And I know our time is up, but it was a phenomenal conversation. We thank you all, Dr. Mingo, Dr. WYTRESS, Dr. Carla. Thank you for coming out, support. Thank you for all of the community who have come out and support. This was a phenomenal time. We promise we will do more sessions like this to have these conversations. So look forward to more things from me and Cindy around this topic and many other topics.
Yeah, definitely.
Thank you so much for organizing.
We really appreciate that you guys came out. Thank you so much for participating in Wellness Week. I think this was a great event for Wellness Week. I want to thank absolutely everyone for participating, for talking, and we hope this dialogue continues, right? On campus, off campus, with your community, off your community. Just get lit, get fired, and just let's do this. So thank you so much. As I put in the chat, my email address, if you guys do want the recording, email me, we'll get it to you guys. So thank you so much again, and we hope you guys have a great Friday.
Yes.
Thank you,
All right,
Thanks,
bye.
everybody.
everyone.
Bye.
Thank you.
Bye.
Thank you so